And so something else that's interesting in BC, and I think that Ontario experienced a little bit of this, when we talk about this pandemic from a more regional approach. So what we see is happening in BC are a lot of the cases are in the Fraser Health and Vancouver Coastal Health region. And then other areas like the Northern region, Interior Health, and Island Health, we're seeing very, very few cases. So do you think that a regional approach to this pandemic has any kind of barrier with how we should move forward, even in schools?
Oh, yeah, 100%. I think regional approach to this pandemic is necessary across the board.
Yeah.
And here's why. This isn't just one epidemic. This is multiple epidemics with multiple faces and personalities and characteristics depending upon the region that you're in.
Yeah.
So it makes no sense to have decisions about Burnaby based upon the experiences in Vancouver and things like that, right? So unfortunately, that presents an administrative challenge.
Yes.
And also a communications challenge.
Yes.
But that's not my job. Like the epidemiologists and scientists can only do so much.
Yeah.
It's time for administrators and managers to step up and show us that they're able to manage complex systems. And that's why they make the big bucks. So make it happen.
Yeah, I agree. I think that it's something that we really need to look at. It could change the face of things for a lot of people. Yeah. And what are your thoughts on taking temperatures in schools, random testing in schools? Do you think that's a good idea?
Okay, so the two different things there. Let's talk about temperatures first. Temperature checks, for the most part, are hygiene theater. They're performative. They make you feel good about doing something. They're not totally let me explain. The idea behind temperature checks is to detect people with a fever who are likely symptomatic and therefore probably have the disease. But not all cases present with fevers. Right. Second of all, not all fevers are cases. Some people have fevers for any number of reasons. Third is that if you have a fever for whatever reason, you might have taken some Tylenol and suppressed it. Yeah. So how many cases are you likely to detect? Probably quite few. How many false positives will you get? Probably a lot. Will you create chaos in the system? Possibly. Having said all that, I still think it's worth doing if done properly. And by properly, I mean with an understanding that your goal here is to maybe catch that one or two cases that would have slipped through the net. And also with an understanding that you do not stigmatize someone for having a fever. You just take them aside and ask them other questions about using the COVID tool and investigate further. Okay, so there's ways to do this delicately without traumatizing someone and creating chaos in the system. And if we do it properly and consistently and passively, maybe we'll catch one case and therefore prevent an outbreak, in which case it's worth it. Now, random testing, on the other hand, I'm all for random testing if it is tolerated by the population. So cultural tolerance and acceptance aside, the beauty of random testing is it allows us to seek out the disease. So there's active surveillance and passive surveillance. With the kind of testing we do now, it's all passive surveillance. And I give the analogy of, let's say you're looking for a cockroach in your dark bedroom. And I've lived in places with cockroaches in my dark bedroom. It isn't fun. So, and you got a flashlight. Okay, and your flashlight is your surveillance tool that you're testing for. You could put the flashlight down and wait for the cockroach to run by, and maybe he'll run by that light. Yeah, that's a passive way of testing. That's like waiting for cases to present themselves to the clinic because they've got symptoms.
Right.
Whereas I can move the flashlight around and I've got a better chance of catching that cockroach in motion. That's active testing. That's hunting down the roach, hunting down the virus. Absolutely, we have to do this if we are serious about preventing outbreaks. Now, of course, you can test positive today, rather test negative today and be positive tomorrow, which means you have to do this consistently all the time. So we should expect random testing as being part of our life, kind of like a drug test, I guess. It is a bit invasive. It can be uncomfortable, which is why we need the rapid, easier spit tests and things like that.
Yeah.
But yeah, I'm pro random testing, absolutely.
Okay. And on that topic, so here's a scenario. We have a child who is in a certain school who presents with a fever and is sent home. That child has a sibling in the same school who is asymptomatic, so that child appears healthy. And I think the guidance that's going on right now in BC is that the child who does not present symptoms can still stay in school. And some parents are a little bit concerned about that approach. What do you think should be done in this case?
That's weird. So these are siblings, right?
Yes.
Okay.
Well,
that is,
they're living in the same household.
okay, right. That is weird to me, based upon what we understand about asymptomatic transmission. Now, if we are assuming no investigation is being performed on that child, that's fairly unscientific to my mind, unless I'm missing something here. It makes more sense to me that if a child in a household we know has the disease, that entire household should be quarantined, and for a couple of weeks, or tested, right, one or the other. So if you're tested, then you can go back to life.
Yeah.
normal.
So what we're seeing here, I'm in Island Health. So what we're seeing is there's about a 2 to 3 day lag time between the time the person is able to access health care and then they get a test maybe a day later. And then within 24 to 48 hours, they're getting their test results. So there's about, 2 to 3 days there where, say, that sibling who's asymptomatic could potentially be in school. So that's what I'm.
Yeah, that to me is flirting with disaster. I don't mean to be so inflammatory, but it's flirting with disaster a bit.
Yeah.
It doesn't take a lot for, again, that ember to land upon some dried leaves and create a fire. So it's just err on the side of safety. Leave the kid at home. The kid will be happy to be at home. His sibling is at home anyway. Hang out together.
Yeah.
They're not going to be quarantined from each other at home anyway. So, and make everyone, a big part of this isn't just infection control. It's also public perception management and fear management. So in addition to controlling the potential for asymptomatic spread, keeping the child at home makes everybody else feel better.
Yeah.
And it helps, restrain the panic. So I'd be much in favor of keeping the child at home while we investigate.
Yeah.
The same way, if someone tests positive in a class, you take the class out of the system. You take the entire class, stay at home while we investigate.
Until you can lock it down. Yeah.
Exactly.
Yeah.